Good morning. Good morning. You are welcome to today's class. We are still on the course PTP 111, Introduction to Principles of Pharmacy Technician Practice. In our last class, we treated the pharmacy technician and pharmacist. That's what we treated in our last class, where we defined each of them and we pointed out one or two things about them: career path, their training, and what have you, if you can remember. So in today's class, we go over to the functions and roles of pharmacists. Functions and roles of pharmacists. Functions and roles of pharmacists. Now, from the history of pharmacy I gave you, we treated in our first class, we discussed that how they started from using herbs around them, right? Herbs and animal drugs they got from animal, extract from animal, plants, and even minerals, and how they were prepared extemporaneously, and how with time we entered industrial revolution. They start manufacturing in the industrial larger scale. If you watch, all these things have been getting towards what? Product, mainly product driven. Those days, even few decades ago, pharmacy was mainly based on what? Products driven, just about drug. But in the recent years, there is a paradigm shift. There's a shift from just product based to patient based. That is shifting from product oriented practice to patient oriented practice. That's why today now you see pharmacists in the hospital. Before, if you go to hospitals, some hospitals, before, what you will see is just a pigeonhole in pharmacy. Pigeonhole, small hole where patient will just stay. Prescription will enter pharmacy. Pharmacist will just get the drug and package and give to the patient. The patient will go. But now, recently, hospitals, new structure now of hospital, the pharmacy in the hospital is not like that. They have broken down that barrier. Now, in recent structures, except the old one that have not changed to the new one, which PCN is enforcing now. PCN is very serious about it. In fact, are you aware that before the hospitals in pharmacy is registered the same way community pharmacy is registered? Are you aware? Hospital in pharmacy is registered. No, sorry, I mean, what did I say? I pharmacy in what? Hospitals. They also have superintendent pharmacist, a pharmacist that register it with his or her license. Pharmacy in the hospital is registered. So any hospital you see they are dispensing drug without a pharmacy, they are doing illegal practice. Any hospital must be duly registered by a pharmacist. The same way you see pharmacy in community pharmacy on the street, the same way hospital pharmacy should have a pharmacy register you with his or her license. Now, before PCN can approve that hospital for where they can practice pharmacy, that hospital pharmacy, you must break down those pigeonholes, because the practice has now shifted from just giving medicine to people to you pharmacists sitting down with patient, speaking to the patient, caring for the patient on the medication aspect. Medication, safe use of what? Safe and effective use of what? Medication. So that's what the origin of clinical pharmacy, from clinical pharmacy to pharmaceutical care now. So it's now patient oriented, not just about drug alone. And that's why you see also shift to PharmD, doctor of what? Pharmacy. Not just about drug now, it's about, yes, drug is still there, medicine, producing medicine, compounding, formulating, but at the same time dispensing, marketing, distribution, at the same time taking care of what? Patient. Not going for surgery, undergoing and carrying out surgical operation on patient, or injection. We are talking about what? Drug therapy. In the aspect of what? Drug therapy. Those things we produce, how is it those people prescribing it for the patient, are they doing it right? What is the effect of what they prescribe on the patient? Is he doing the work? Okay, if he's doing his work, is there any harm on the patient? Is there cases of overdose? And you are the one to, in fact, they go for ward round with other healthcare team, where each of the healthcare team is contributing to the patient care. The patient doesn't belong to the doctor alone. The patient belongs to the doctor, belongs to the pharmacist, belongs to the nurse, belongs to the medical lab scientist, belongs to the physiotherapist, depending on the case. So it belongs to the healthcare team. Even social workers should also be part of the healthcare team. Now, the pharmacist is there. Everything that has to do with drug, review drugs that the patient has been placed on or will still be placed on. Look at it. It's the pharmacist that should contribute. Pharmacy working in the pharmacy sector should contribute what that should be done with respect to drug therapy. Am I communicating? So that's what we mean by what? Paradigm shifting from product-oriented practice to what? Patient-oriented. Even not just limited to patient, even to level of even health outcome. Yes, you have treated. So what is outcome of the treatment? Do you know? Did you follow up the patient and know what happened to the patient at the end of the whole thing? So this is what pharmacy also covers now, unlike before. So we call it what? We call this approach pharmaceutical care. We call it what? Pharmaceutical care. So pharmaceutical care is actually a system where pharmacists working with other health care professionals to take responsibility for patient outcomes with respect to medication use. With respect to what? Medication use. Not diagnosis, not surgery, not injection, administration. No. Drug, medication use. There's a whole lot to do in the aspect of medication use. Because a lot of patients died in the hospital because of even not using the medication the right way. Are you aware? Or not given the right medication. It happens. Nobody is perfect. That's why it's a healthcare thing. Nobody is perfect. I keep telling this story of where I worked before I entered into academics. I was HOD in the hospital pharmacy. This was around 2019. 218/2019. I was the HOD in the pharmacy then. It's just a private establishment, not government. But then I was the only pharmacist anyway. The other one resigned. I now took over. So, but I have pharmacy technicians around me. So I had to start training them, organizing lectures for them every morning before patients start coming, so that they'll be able to, take charge of some things, because I cannot be everywhere, because I was the only pharmacist there. We are running heart to heart. I was in charge of heart to heart, and other unit in the department. So what am I? So there was a case of a patient, a case of a if a physician prescribed a patient has diarrhea, you know, all these if the patient has diarrhea and the ulcer at the same time, by the time you come up and do AUM, you appreciate what I'm saying. The patient has diarrhea and ulcer at the same time, so the antacid prescribed for the patient under normal circumstance causes a side effect. Diarrhea can cause what? Diarrhea. So, but the physician, I don't know what happened. He just prescribed. So the pharmacy technician that was working under me then, immediately he saw because there the folder comes in. And that thing is that folder should be entering pharmacy. Pharmacy personnel should look at the folder. It's not to go and start looking at it. Look at it with reference to what? Medication, not that piece of paper they prescribe. No, all the healthcare team should see patients what? Folder. So any hospital that know what they are doing, folder enters the pharmacy, not piece of paper. Prescription. So because the folder entered, she opened the folder. Immediately she saw the prescription, she came to me. She was like, sir, I don't think this is good for look at what they queried. This patient has diarrhea, but look at what the type of antacid she prescribed. I don't know, sir, what do you think? I laughed. Wow, I was so impressed. And I said, okay, it's good. I like that. Oh yeah, go and speak to the doctor. She became afraid. I said, why are you afraid? He said, no, sir, go. I said, I empower you, go. Don't worry, just go. He will not bite you. Tell him I sent you. She said, okay. She went and spoke to the doctor. Immediately the doctor saw it, he shouted. He was like, wow. So he now corrected it and changed another word, antacid. Throughout that day, you will see how, not throughout that day, there is this confidence in that pharmacy technician that she contributed to the better health outcome of what? The patient. So it's not just about giving drug. But the issue is this: if she did not study when she was in school or continue studying, if she just came to school to play while away her time, like some of you are doing, very unserious, I would not lie to you now. I'll tell you the way it is. I'll hit it to you whether I like it or not. If you like, hate me. I'll tell you the truth so you can wake up and study. I'm not here to pamper you. I'll tell you how it is. Some of you are not serious. If she was so serious in school and not laying the foundation to study her AUM very well, study her courses very well, do you think she will be able to see that thing? No, now. You cannot give what you don't have now. How can you give what you don't have? Is it possible? No, it's because she knew, she studied. That's why she was able to point. If she didn't say, if she don't study, she would have just become a robot that is carrying food up and down. Food that coming pharmacy, food that will go to shelf, bring drug. Move. I was the only pharmacist there, but she saw it. Had it been it was the food that entered in the hand of someone that is not serious, she would just her only just to look at the drug, eat the drug, and go and do what? Of course, there are many patients that I can't. If I am to be the one to only want me to be giving patient drug, that means they will tear me into pieces, because a lot of patients are always in large numbers. So I have to equip them to be able to do what? Help me carry out some what? Tasks that are pharmacist tasks. Why I watch them and monitor them and guide them. So because under my tutelage she was able to do that, I was proud of myself and she was proud of herself that she was able to do what? Help out. So this is what we're talking about. It's not just about product now, because if it was about product, she wouldn't have bothered looking at the folder. Her eyes will just be only on the drug. She pack it and go and give the patient. But because she knew that it's not just about, it's about the patient too, she just glanced through, and she was able to. Someone will say, are you a doctor? Had even she didn't go through it, would she have seen it? Would the doctor the doctor wouldn't have been able to do what, make that what, correction. Sometimes it may be that they don't know, but basically they, a lot of them know. But it may be that even the doctors on their own, a lot of patients are lined up. It's not easy to sit down one place and be attending to up to 50 patients a day. It's not easy. Sometimes your brain will start firing. Have you ever been in a place for a long time, or even teaching on the board? Your mouth is saying A, your brain is interpreting C, but your hand is writing D. It has happened to me, so I know what it means that to talk or sit down in a place or work for a long, your brain will start just the same way a system. This thing you see is, this computer is fabricated or whatever in human form. Sometimes the computer, if it work for a long time, it will start misbehaving. Even your phone, if you restart, it will do what? The same thing with human beings. That's how you work, when your brain will start doing nonsense. But if you rest or sleep, you what? Refreshed. So it's not easy. That's why we work together as what? Healthcare what? Team. Any error from here can be detected from this side. It's not to fight each other, no. It's to help each other, work together to help the patient. Are we together? So have that mindset. So all the departments you see here, don't see them as your what? Competitors. See them as people you work with tomorrow to be able to save lives. Are we together? All right, so that's what I mean by moving from drug-oriented, product-oriented practice to what? Patient-oriented practice. So the modern pharmacist principal task, the modern pharmacist principal task are as follows. One, to identify, resolve, and prevent drug-related problems. Identify, resolve, and prevent drug-related problems. Now, that my pharmacy technician, even though the lady is not a pharmacist, but she performed pharmacist tasks, right? Yeah, because I walked through her. She was able to perform that task because I cannot be everywhere at any point in time. Did she perform this three tasks I mentioned? She identified potential issue, right? Yes, by looking at through the folders, and she came to me. Of course, you have to go to your what? Pharmacist. Then we resolved it, right? So having resolved it now, we ended up what? Preventing drug-related what? Problem. Because had it been a patient went on with that antacid, sorry, I don't know the type of fluid the patient would have lost before they detect where the problem is. You don't know where the problem is coming from, because she will be taking the drug and she will be busy dehydrated, and because of the ulcer, she will be taking the drug because of the ulcer, but she won't know where her problem is coming from. So the drug related problem, we are able to do what? Prevent it. Are we together? So in all, the mission of the pharmacist task aligns with the essential drug policy, which is enshrined in a right drug to the right patient at the right time, in the right dose, through the right route, in the right way. How many rights did I mention? Right drug to the right patient at the right time, in the right dose, through the right route, in the right way. So I mentioned 6 rights, right? I said the right drug, right patient, the right drug to the right patient at the right time, in the right dose, through the right route, in the right way. Now let's look at the functions of pharmacists. Let's look at functions of pharmacists. Route, the one you call route. R-O-U-T-E, the one you call route is route. Okay, routes of drug abuse are through the pathways through which the drug enters the body, through which drug are administered into the body, like IV, orally, vaginally, muscularly, all those. Is that clear? All right. So let's look at functions of pharmacists. So pharmacists perform various functions in promoting health. We have a lot of functions in promoting health. In promoting health, 1, promoting health. 2, in ensuring safe medication use and maintaining professional standards. So we play a lot of role in 1, promoting health, ensuring safe medication use, and maintaining professional standards. Are we together? Yes, we are. I'm sure we are together. Now, so we will look at the functions of pharmacists under different headings. We look at it as under the pharmacists as communicators, under quality drug supplier, under trainer and supervisor, as health promoters, as collaborators. So let's go. Then pharmacists as communicators. As communicators, pharmacists engage patients and physicians in dialogue. True of us. As communicator, pharmacists engage what? Physician and what? Patients in what? Dialogue. But if you are discussing with your patient, find out what drug he's on, the one he's taking, if there's any issue, how to take the drug. Are you not communicating? If you're not a good communicator, that means as a pharmacist, you must be a good communicator. Because if you don't communicate, a lot of problems in relationship, interaction between people, interpersonal relationship stems from bad communication, poor communication skills. Even in marriage, true of us, breakdown in relationship, friendship, a lot of them, there's always communication issue. Maybe you're not communicating what you truly have in mind. Communication may not necessarily come from what you say. My facial expression is communication too. I can communicate from my facial expression. I can communicate from the tone of my voice. The tone I can communicate. I can communicate through the pitch of my voice. If I do something to you now, or you're a patient or a client, you are talking to me, I'll be like, take this one 2-3 times in a day. How do you feel? You are before me. Take this 3 times a day. My facial expression alone, the voice, the pitch, you be like, oh boy, am I safe with this pharmacist? Did I tell you that I'm not happy? I did say so, but the tone of my voice, not even tone, the pitch is enough to say it. True of us. Then even the body language, immediately you now come to my close to me for me to give you your mess. I will shift. I'll shift like this. You'll be like, am I smelling? You'll be like, is my mouth smelling? In your mind, why is she or he moving away from me? You'll not be happy. And believe me, that will even affect that drug treatments. So communication is not just about, so as a pharmacy, not just pharmacist alone, pharmacy professional that is engaged with patient, that you must be what? You must be learn communication skill. That's why you do communication skills. You must learn how to communicate. In your primary health care, you still do communication skill. Even in your English now, English 101, you will do communication skill. Second year, you still do communication skill. I'm also talking about it. So it's very important. So you have to be a good communicator. So then, now as a good communicator, pharmacist collects detailed medication history. I think I mentioned it here now. When you are asking your patient about the drugs he has used before, you are getting the medication history of the patient. Even though, yes, if the patient is a patient that has been with the hospital, you can still get it from the folder, but at least one-on-one, because some may still go out and visit and take one abo, go to one chemist and get, even when they are on the medication prescribed by the physician in the hospital, they will still go jumping up and down. So we go to one prayer ministry and get the one they put in a bottle. When they miss all these things, they won't know where the problem is coming from. At the end, they say that the medicine is not working. So get medication history, what the person has been on. Also, even on the cases, even in the case of, for the cases of maybe reactions to a particular drug, or some people may be idiosyncratic. Some may have idiosyncrasies to a particular drug because of their pharmacogenetic makeup and their pharmacogenomics. They may having issues with a particular drug. You, this boy, come here, come and sit here, fast. Come and sit here. So they find out already. So this is what you do under medication history. So as a good communicator, for you to be able to achieve this, for you to be able to collect proper detailed medication history, you must be a good communicator. True of us. So this is the function of patient. Now the pharmacist advises patients on correct use of drug, side effects, and safety. If the pharmacist is not a good communicator, he will not be able to do achieve this. Are you aware? He will not be able to do achieve this. Then pharmacists also provide, as good communicators, provide objective, evidence-based drug information. That's why anybody that want to get even till today, the fact that I am no longer in the hospital practice or community practice. Till today, people still call me to get information on drugs. I said provides objective, evidence-based drug information. People still call me today to get information on drug. Somebody I haven't spoken to for the past how many years, close to 10 years now, from nowhere, her call entered my phone. She was asking, she's a physiotherapist. She was asking about information on the drug, right drug to use for her baby. So I had to listen to her, get the history of the drug the baby has been using and everything, and now give my own recommendation. So if you don't have, if you're not a good communicator, you're not able to do provide such information. Apart from knowing it is one thing, true of us. Then another one is to do how to do communicate it. Very important. Even what I'm doing here now, this lecturing now, is also part of it. I can do that because at least I know that I'm a good communicator. If you say that to a teacher and you cannot communicate to a student, you're wasting your time. So by virtue of being a pharmacist, by fire by force, and also from wealth of experience, even in the aspect of sales rep, After I've worked as sales rep, I've worked at detailing. So we have sales rep, those that just carry drug and be selling, that go around. I worked in that capacity. I've also worked as a detailing pharmacist, but just to be carrying laptop and be speaking grammar from one hospital to another hospital, doing presentation, speaking grammar, so telling doctors about a product. So if I'm not a good communicator, I will not be able to serve in that capacity. And all these things help me today to be able to do what I'm doing today. All those the experience I gathered in all these aspects, the different aspects of pharmacy, is what is helping me today to be able to speak with you now, and to you with authority, and ask you to record it and share anywhere you want to share, and record it and share it anywhere you want to share, without being afraid of what people will say if they hear what I'm saying. Without that, I don't think I have that confidence to be able to do that. What am I saying? As a pharmacist, you should be a good communicator. Then, so as a good communicator, pharmacist also maintains confidentiality. Pharmacist maintains confidentiality and assists in self-medication when appropriate. Maintains confidentiality and assists in self-medication when appropriate. You not everything that you rush and start. There are some things some cases like that one I told you now about one of my colleagues, a physiotherapist that called me. I know the one I can recommend. Is that clear? I know exactly the one I can say use this, and I know the ones I can say please at this point go and see a physician. At this point, don't take any other. I know I do it to people. In fact, I do to people that to say that some people don't like it because they expect to them I should give them something. Some insist I should give them. I say no, I'm not giving. Go and see a physician. If you want me to recommend, I recommend see so person. When you are done with physician, you can come back. Let's continue with whatever he asked you to do. So that when appropriate, you can do that. A pharmacist can do or recommend some medication for patients. Then of course confidentiality cannot be overemphasized. So as pharmacist, you should be very, very secretive. Not everything, because people come to you, people trust you, people come to you to talk to you, speak to you. By virtue of my training and my experience, my experience, you can beat your chest that if you tell me something, I'll take it to grave. That's the end. Because it's about your health. The same way you also have to build that character, that personality, so that person can trust you, talk to you, speak to you. You know that they go, do you know this one? Do you know how many times here? Don't mind them. So if you're like that, I'm sorry, start working on yourself now. Then if you know you cannot work, if you know you cannot, just go and look for something else to do, because here is not for you. So confidentiality, very, very important. Now let's look at pharmacists as quality drug supplier. In fact, people trust pharmacists to the extent that if somebody that is not a pharmacist come with those days I was working as sales rep, and anytime they see me coming with my products, they prefer to attend to me first. Come, because to them they believe that whatever I want to give them is quality. That's their belief, that whatever is coming from a pharmacist should be quality. They believe that others may cut corners just to make money. But the pharmacist swore an oath to ensure that he gives the right medication. Meaning that whatever he is doing is on oath. Whatever I'm doing, even here I'm teaching, is on that oath too. Because I've sworn the oath. That's why That's why you can't cut corners around me. Sorry, I'm not that person. I'm the wrong person. I am the very, very wrong guy when what you want to do is to do what? Cut corners. You cannot work. It never worked in my 6 years of teaching as a lecturer. It never worked, and people hate me for it. I don't care. Today they will like me, tomorrow they will hate me. When they graduate, they will not like me forever. But in school, they will not like me because what they want to achieve, I don't give it. Either by kind or by cash, it doesn't work. Do the right thing, and you get the right score. It's not magic. It's garbage in what? You cannot reap what you don't sow. If what you sow here is to be jumping up and down, whining your bum on TikTok and jumping the whole streets, that's what you get at the end. There's no magic now. I don't know. You may do magic in other courses, so if it's possible, but not in my own course. I'm sorry, because I swore an oath during my induction day. So it's part of the practice. Because if I mess up with you, I don't know whether you are the one to attend to my children tomorrow. Yes, I don't know. So you carry your empty head and go and give drug. No. So this our job here is a delicate one. Because if you make mistake in forming, in producing in growing those that will continue the profession, the profession will die. The profession will die. So that's why we must get it right, so that it will continue. 20 years ago, 19 years ago to 15 years back, I was like this, sitting down. People like Professor Agowa, that the one I mentioned, and many of them were on the board like this, teaching us. They handed us over to us. Now it's my time to do what? Hand over. If they handed over to me nonsense, I'll package that same nonsense and do what? Hand over to you. Before it was going on, pharmacy profession will do what? Die. A natural death. But because they handed over to me quality, I build upon that. That's why I can sit down here confidently and hand over to you, hoping to build the next generation of what? Those that lecturers that will teach others. Everybody must not be lecturer, and everybody must not go to the hospital and practice. People must teach others, because if there's no quality people to teach others, the profession will die. It will die now. Highest next 20 years, no pharmacy again, because nobody to teach, to build new what generation what pharmacists or pharmacy technicians to continue the what profession. So what also on the drug quality supplier, pharmacist ensures drugs are sourced from reputable manufacturers. Drugs are sourced from reputable manufacturers. Very important. Some may not, others that are not in pharmacy profession may not care. What they care is this one. What is the profit margin? Their profit margin is 2,000 naira per packet. This one, their profit margin is 200 naira. Nah, that's what they care about, because they see drug as what? Commodity. They see medicine as what? Commodity. But we in pharmacy see it as what? Life saver. We see it as life saver, not just article of trade. It's because some people see drugs as article of trade. That's why some human being can get a medicine that is about to expire. You go and change the date and put a new date, because he see it as what? Article of what you said to make money, not about what to be dispensed to save life. They didn't take any oath, so they don't care. That's why PCN is fighting. The government is fighting to ensure that it's only those that are trained. Of course, you take oath. Are you aware? Are you aware? You didn't. Okay, by the time you graduate in your third year, after your council exam, those that pass council exam will be inducted. What do you think induction is all about? Okay, you have not witnessed induction. You are taking oath. Yes, after your council exam, in your induction, you take oath. That oath, yes. It's professional oath now. Oath to save life, do honestly. It's not. Eh? Yes, now. No, it's not blood oath too. See, there's something people don't know. That day we may just gather, of course. Okay, you soon witness the next people that will do their own. We gather, everybody will stand up, they will administer oath, they will say, I promise, blah, 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 blah. They don't know, see, all these things are effective. Whatever you say with your mouth is very effective. So you don't just behave anyhow. That's why they are everything possible to ensure that those that handle medicine are trained. At least let the person be a pharmacy technician. Because we believe that this one passed through 3 years training, no be here. 3 years rigorous training, and at the end inducted into the profession. It's a serious thing. It's not what you just throw away like that and to say it's nothing. It's something. So as a quality drug supplier, pharmacists also ensure proper drug storage and handling. Proper drug storage and handling. The way pharmacists of pharmacy professional will handle drug is not the same way someone that they just brought from the village. He will learn. He will stay with his oga and they learn how to sell medicine. The way you handle is still the same thing, because what you are seeing in drug is not what the person is seeing. The person can just carry it, throw it any way you see, but you can never do that. In your subconscious mind, you can't do that, because this is what you spend almost number of years studying about. You value it. Because you know that it can make or mar people. True of us, yes, it can save. It can also do what? Destroy. If not well, handle. So let's look at pharmacist as a trainer and supervisor. Pharmacist as a trainer and supervisor, pharmacist engages in continuing professional development. As I am now, I keep developing myself continually. Even those that I trained, pharmacy technicians that I have trained over years, sometimes still contact me for one thing or the other. I still contribute in their own professional development. Then pharmacists also train and supervises non-pharmacist staff. I told you how I was training pharmacy technician, right? And pharmacy assistants that were working for me in the hospital. Then apart from the hospital, the what I'm doing here is also, I'm also playing the role of a pharmacist as a trainer and supervisor. The same thing, pharmacists in the university teaching pharmacy students, the same thing. So as a trainer and a supervisor, pharmacist also develops referral protocols and ensure service standards. Develop referral protocols and ensure service standards. Of course, you should know, pharmacists know when and how to do what to refer, right? Remember what I told you, that there's a case you bring to me. If you like, someone say, you are good now, you can do this now. It's not you. I say, I know I'm good, but this one you must see a physician, because my training and his training are not the same thing. Even if I have read it somewhere, but I cannot go and start doing it, let him do it. It's very important to know your limits. You don't encroach. Even you as a pharmacy technician, know your limit. Don't do what? Encroach. It's very wrong. Do not encroach. Limit yourself. Maintain your what? Know your boundaries. Know when you start crossing into the pharmacist's boundary. Even if, yes, the pharmacist allow you to do it, just know that he allowed you. It's not your what? So, see, there are some of my students in the past, even when they go for IT, they come back and start complaining. Sir, they don't allow us to do anything. They don't allow us to attend to patient. I say, where a pharmacist is, that one pharmacist allowed you, doesn't mean that what you should. That is the duty of what? The pharmacist. Where a pharmacist is, he should do his work. Your work is not to do what? See patient one-on-one. It's not your work as a pharmacy technician. It's not your work at all. Your work is to do what? Fill prescription for the what? For pharmacist. Do other non-clinical jobs. Make sure that the store and purchases are well done. That drugs are supplied at where they are needed at the right time. Is that clear? Then some pharmacists may look at you because of the type of skills you have shown them, because of the level of knowledge. There's some pharmacists, once you come to where they are working, they'll start asking you questions. They'll start asking you questions about some courses, about some drugs. They are trying to find out what you know. They are trying to find out whether they can relegate somewhat responsibilities to you, or whether they should just keep you there. So if they see that you have nothing inside, they'll keep you there because they cannot risk it. They can't do what? Risk it. But if they see that you are smart, you are sharp, you are loaded, you become their 5 and 6. In fact, they will be confident even if they're not around. You see that will do society because they know. Then other pharmacy technicians may start becoming jealous of you. The empty ones will start becoming jealous of you. It's not your fault. When they were in school, they were gallivanting up and down. You can say pass without even knowing anything. Are you aware? Anyway, that one is for not for my course. So you must know it by fire by force. My only by fire by force. I'm not begging you to know. You must know it. All right. So let's look at pharmacists as health promoters. Let's look at pharmacists as health promoters. So as health promoters, pharmacists participate in health screening and disease prevention. Health screening and disease prevention. It's not the standard lab. Just minor health screening. Look at the patient, ask questions, do diabetes, blood, this thing, using glucometer, sugar level, BP. Then some pharmacy have this what is it called? This machine that dictates sub health. This one they call computer lab. The computer, this thing, what is it again? I've forgotten the name. That does not replace lab. That will just give you an idea of what is going on in the patient body. I've forgotten the if I remember it, I'll say they normally use it for health screening in some, not all. I've seen it in some pharmacy. The patient will just come, they will run the total, they check the entire system of the body. Quantum, God bless you. Quantum. That thing is very good though. But see what it does. There's what is called Sub health, sub. See me, I didn't even write that on the board, and I'm talking for the past how many minutes. Mark a place. There's what is called sub health. Sub health. Are you aware that there are some you may not? Are you aware that you may be sub health? Are you aware that you may be feeling some? You know that your system you are not okay. Something is not. But if you go to lab, you not see anything. Are you aware? It happens. Most of these cases happen at level of sub health. This quantum can detect if you're about to develop cardiovascular disease in the next 5 years. Quantum machine will say that, will detect it, that watch your heart condition, watch your heart health. If you develop cancer in some years to come, it will detect it. If you develop liver issues in some years to come, it will detect it. But if you go to normal wet lab, you won't see anything. So what it tells you is that look at to watch here, please there's tendency that you develop so this thing. Please watch, modify your life style. So it's left for you. It's not to be taking drug. It's left for you to do what? That's why it's under health promotion. It's not disease, even though yes, disease treating is also a part of it too. That is the last part of call. But disease prevention, especially chronic diseases, it will detect it. So what you need to do is just to do what? Watch what you eat. Some of you today cannot do without carbonated drink. They cannot do without it. They can't do without eating junks. Now, if let's assume that I am the pharmacist now, I have such machine, and I detect such. What I'll tell you, monitor your what? Salt intake. Know how you eat. If I stop eating refined, processed food, if you want to eat, go and eat. Sit down, make good soup. And as I'm making your soup, in fact, if possible, stop using all these artificial seasonings. Go to natural one. These are things I will tell you. Drink a lot of water, take fruits. But if you don't and keep living the way you want to live, highest 1, 2, 3 years you develop that same disease the machine detected. I'm telling you from experience. I've seen it happen in somebody, detected in somebody. The person later developed it and later died of that disease. I saw it. I've seen it all. So when I say that sub health exists, this sub health, you cannot see you cannot detect anything. If you go to the lab, you don't see anything. It's only that quantum machine can detect it. So it's part of health screening. So when they now do total screening of your entire system, you will now be advised on what to do and what to avoid, how to live your life, what to eat and what not to eat. So you don't develop. But if you have already developed that issue, fine. Then treatment will do what? Ensue. Is that clear? So that's one of the roles pharmacists play as what? Health promoters. So that's why you are doing primary health care, because sometimes the patient may enter your BC. You may not necessarily the pharmacy may not necessarily go and start recommending drugs. So there's some maybe just one or two things. Some maybe just lifestyle modification can help the patient. Then once in a while, fast. Is it fasting? Very important. Fasting, very important. Fasting is healing too. Fasting is healing. I'm telling you from experience, it's healing. Because if you fast, you give your body space to rejuvenate, to rest. Sometimes allow your GIT to rest for some time. Not all the time like parrot. Anything you see, you eat almost 24 hours a day. Okay, so this is part of the what? Because if health is promoted well, disease will be what? Prevented. Disease will be what? Prevented. So these are the things you do in your primary health care. Health promotion is part of it, part of health education. You will do as a topic in your primary health care. So when you get there, you will learn all those ones. But just know that pharmacists, we are health promoters. So it's not everybody that enters your pharmacy that you collect money from. Yes, you may have the consultation fee, but it's not everybody you collect money. Some you just talk to them, and they will always come back to you. They will always do what? Come back to you. So pharmacists are, let's look at the function as collaborators. Let's look at the function of pharmacists as collaborators. So as collaborators, pharmacists work collectively with healthcare professionals. As collaborators, pharmacists work collectively with what? Other healthcare professionals. I think I have mentioned that, right? Then apart from healthcare professionals, they also work with industries. Even with governments, yes. We partner with governments. We collaborate with government on the drug-related issues. We advise the government on drug issues. True of us? Yes. So that's why we have in every government establishment, in every secretariat, be it federal or state, you have pharmaceutical services departments. We have what? Pharmaceutical services what? Department. We have directors of pharmaceutical services in every government secretariat. Even as agency, we have Pharmacy Council of what? Nigeria. So government partner with pharmacists or pharmacy professionals to be able to do what? Help the people. So we collaborate with government even with what? Patients too. Because if we don't collaborate with patients, will you be able to take care of the patient? You are trying to work with patient, and the patient is giving you attitude, and the patient refuses to respond. Will you be able to help that patient? So pharmacists as collaborators also share expertise and data to enhance self-care and medication safety. Then let's look at roles of pharmacists. Roles. Here now, this one we will tie this. These roles will be tied with different area of specialization of what? The role each area of specialization or each area of specialization play. Is that clear? Here now, I am a pharmacist, right? But my area is academics. I'm a pharmacist, but my area here is what? Academic. So I am an academic pharmacist. I don't have one community pharmacy somewhere. Even if I have tomorrow, I can't leave my work here and go there. Three of us. If I have tomorrow, I may just employ another pharmacist that will be there working, not me. Because I can't leave my work teaching and go there and start working. If I move, who will teach? Nobody will teach. So everybody must focus on his or her own what area, so that the profession can grow. So if all the other pharmacists come here and be teaching, sit there morning and night, will it work? That's why some that come in for part-time what basis, like me, I'm full-time here. That's why I cannot just go. Even if I want to work in community of, it will be part-time, maybe in the evening I'll go there and work. Some pharmacists that come here to teach, maybe they work in the hospital. Maybe if they have, even that one self is even somehow, because you are leaving patients you should attend to, and you are coming here to teach. Except there's a way they do it, that place, that a pharmacist will be on ground. The one will take permission and come and teach and go back. No problem. Provided that there's a pharmacist there working. The same thing, some that are part-time are working in the community pharmacy. They come and teach and go back. But if everyone leave where they are coming and stay, then the profession will die. We have issue. So now, even if I have a community pharmacy tomorrow or whatever tomorrow, I will employ those that work there. I may just go there, maybe if I have no class, or maybe after work I will just go there, see what they are doing there and come back. Maybe in the evening I go just go there and stay and close with them. But I'm not that I will go there anymore and sit down there when I have things to do here. So my area is what? Academic what? Pharmacist. So I am an academic what? Pharmacist. So let's look at the role. Let's look at my role as an academic pharmacist. Let's look at my role as an academic what? Pharmacist. Huh? Okay. So as academic pharmacist involved in what? Teaching, research and what? Training. Teaching, research and what? Training. Both at the university level, colleges of health, science and technology. Even say we also have pharmacists even in other colleges of health, even college of industrial sciences. They teach the pharmacology there. Three of us. So academic pharmacist organizes seminars, workshops, and academic what programs. I've already told you that we will do that. We will soon start with a what seminar here. So you will organize what seminar. You come here and talk to us. So I'll teach you. When I'm done teaching you, I'll sit down here. You teach me. See your eyes. So you come and speak. Yes, you must be confident to talk. You must learn how to communicate. You have to talk. You have to know what it means. So you learn it. Okay. So it was done when we were in school. We did that same thing. So, and it helped me a lot too. So then academic pharmacists provide foundational and postgraduate education in pharmaceutical sciences. Provides foundational and postgraduate education in pharmaceutical sciences. What you are doing here now is foundational education. Are you aware? Yeah. This is foundational what? Education we are. Okay. I should repeat what I said. I said that they provide foundational and postgraduate education in pharmaceutical sciences. Now let's look at industrial pharmacists. Industrial pharmacist handles research and development. Industrial pharmacist handles research and development, manufacturing, quality assurance, patent application and marketing. I said that industrial pharmacists handles research and development, manufacturing, quality assurance, patent applications and marketing. Yes, I'm marketing. Yes, when I was in the manufacturing outlet too. When I was in the manufacturing outlet, we were not just manufacturing. We conducted research as per the new product we want to launch, ranging from the formulation and comparing it with other brands in the market, doing analysis and other things about the other brands in the market. We were able to come up with a better formulation that will be able to give us what we believe will help us penetrate the market. So we also manufacture. Of course, quality assurance is there to check the quality of what you are producing from time to time. Then of course, even in that manufacturing company, because of my knowledge of marketing and sales rep, I was able to help the company to market their products. So this is what industrial pharmacist does. Then industrial pharmacist also ensures good manufacturing practices. GMP, good manufacturing practices, and also participate in clinical trials. And post-marketing surveillance. Post-marketing surveillance is that maybe after a particular drug is launched in the market, before a new drug is if they discover a new drug, post-marketing surveillance, post-marketing surveillance. After producing a particular drug, I mean drug, not medicine, drug itself, a new drug, the company, there are some side effects that they will not see while doing clinical trials of the drug. But when the drug has entered the market now, when people start taking the drug, they start complaining and start reporting about some particular side effect or adverse effect. So the company also look out for those things. So when a company is looking out to see if there is any complaint, any report on the side effect or adverse effect they did not see about the drug when they were doing clinical trials, all this information is called what? Post-marketing surveillance or pharmacovigilance. Post-marketing surveillance or pharmacovigilance. Post-market surveillance or pharmacovigilance. I don't want to go deep into that. You still do it, treat it. I just mentioned it at passing. So industrial pharmacists also promote ethical marketing and management practices. Promote ethical marketing and management practices. Now let's look at the role of role of pharmacists as primary care and prescribing advisors. Primary care and the prescribing advisors. Primary care / prescribing advisor. So actually pharmacists also play vital role in different health organizations where they manage local healthcare services. If you go to some PHC now, that there are CEOs are employing for pharmacists. Are you aware? Yes. I just use PHC as an example now. The pharmacists also run medication review clinics. I will say something. After 2 minutes, he will ask his own. I said that pharmacists also as their role as primary care / prescribing advisor, that they work in health organizations where they manage local health care services. And I mentioned example, I use PhD as an example. Pharmacists also run medication review clinics. Pharmacists run medication review clinics. Here, they ensure the best use of medicines and resources. They run medication review clinic where they ensure best use of what? Medicines and what? Resources. Now let's look at the role of community pharmacists. For community pharmacists. Community pharmacists. I told you that community pharmacy are those ones you see on the street, right? In the road. Good. So community pharmacists, they work directly with the public. Community pharmacists work directly with the what? Public. Where they offer counseling and health education. In fact, they do that one very well. That's why till today, pharmacy is always the first port of call. When people fall sick, they want to go and see the pharmacist first. If you mention doctor, if you mention hospital, if you mention hospital, some will even warn you self. Be careful. I'm not going there. But sometimes if the pharmacist that will now be one to tell them to go to hospital before they will now agree and start going. So that's to tell you how powerful community pharmacy is in the community. So they work directly with what? With the public, offering drug, counseling and what? Health education. Okay, is that what I'm waiting for since? Okay now. So community pharmacists, community pharmacists dispense medicines and advise the patient on what? Drug use, medicine use, especially over-the-counter use of medicine. They also provide services like blood pressure monitoring. I mentioned it, right? Blood pressure monitoring, diabetes management. In fact, most hypertensive patients and diabetes patients go to pharmacies. Most of them go to pharmacies. Then some, depending on what some can be referred, depending on what is on ground. But most of them go to what? Pharmacies. So they provide services such as blood pressure monitoring, diabetes management, smoking cessation. So let me start from here. If you're a smoker, be delivered from your what is it called? From the spirit of, if there's any spirit behind that one, from the spirit of smoking, cease. Is dangerous for your health. Cease. They cease from it. It's dangerous for you. Wait. Hello? Is it you're laughing? Is it lecture coming now? Yes, sir. No, go out. No, go. Thank you. You don't attend this lecture. 19 minutes to 10. You are coming from my lecture by 2 hours lecture. 2 hours lecture. You are coming 19 minutes to. You don't attend class. You say what? Hold up. You say what? From where? Where? How many hours for that prejudice, please? When did you leave your house? Don't lie, you. When did you leave your house? Tell me. By 7. That means you should be leaving by 6 or 5. Or what? Why are you not in the hostel? Or why don't you? Huh? No, for boys. Why didn't you look for accommodation here or pair with your class rep? Because sorry, I mean you are class members. Weekend you go back. There's more wisdom. There's wisdom there too. In fact, come. Let me see. Come here. Because it's not about coming to class and write that. It's about missing things that will help you tomorrow. You are missing a lot. You are missing a lot. And these things will boost your confidence when you start practicing. If you are missing classes, you don't have that confidence because you know that there are a lot of things you not learn. If where you're saying is far, you can discuss. Look for accommodation here. If you don't have accommodation here, you can. Why are they laughing? Shift. You say what? What do you say now? So some of you think we are joking here. They play. Continue playing. Huh? So do you know what I'm saying? Even if you can pair up with somebody here, Monday, Sunday evening you come back. If you must go home, weekend you after lecture Friday you go. Sunday evening you come back so that you don't miss your classes. Look at you miss a lot of things in this class. And I know that the things I post, I know you don't listen to them. I even in my WhatsApp group, the thing I post, I know you see it and do as right. You don't click on it, and you yourself don't even record my lectures. So these things are what can help you out. At least even if you miss the class, you listen to it than just copying notes. You don't even know what the person is copying. What's your name? Huh? What I told you, is it possible? Think about it. Act fast. Please, you are in first year. Please don't start like this. You have a lot to lose if you continue like this. Look at time. Go and sit down. Okay, so I said that they provide services such as blood pressure monitoring, diabetes management, smoking cessation, and sexual health counseling. Yes, even me as a woman, I know people that talk to me, but the patient, let me use client now, because they were not sick, they were just having issue with giving birth. They when I was in community till today, so sorry, even when I left that place, they were calling me for their sexual health. Those that, why are you laughing? Why that anytime sex is mentioned, people just be laughing up and down. Even those in health profession. If others laugh, you should not be laughing. It's something serious. These are things you help people out tomorrow to solve, and you're laughing. Why must your laughter coincide with what I'm talking about, sexual health? I'm sorry. I speak that because it coincides. Is it a coincidence? They were coming to me for those that had no children at all, no child at all, or some that were looking for a boy or a girl. Sex selection and everything. And so some of them, some of them at the end, they will say thank you, blah, 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 you know, that they were able to get this, you know, this counseling, this information help them out to to be able to do what? Save their marriages before they come back home and see another woman. So some pharmacists own and manage pharmacies around. Of course, you know that one. Not even some. All, especially retail pharmacies, are owned by pharmacists, except those that are wholesalers. I think we have discussed that here, right? Mm-hmm. So then we also have pharmacists with special interest. So they are pharmacists with special interest. Those ones, they play roles like they specialize in areas like oncology. What is oncology? Oncology is what? What is oncology talking about? It's talking about cancer. Cancer is oncology. The same way we have gynecology, blah blah blah. We have oncology talks about what? Cancer. So cancer, we have oncology pharmacists where they specialize in cancer treatment with respect to drugs. That's their own area. That's where they play their own role. Some are in their own area is the diabetes management. Everything that has to do with diabetes medication, how to tell safe use of medication and that diabetic medication and what have you, everything about them. That they are the authority to tell you about what to do in that area. Some are into hypertension. That's where they are. Cardiovascular issues. Some are into cholesterol, specialties. Some are focused on how to tobacco cessation programs. Some are focused on immunization. So they are under what the pharmacists with special what interest. Then the next role is we have the hospital pharmacists. So hospital pharmacists, these ones are in the, of course we've talked about them, right? You know them, right? They are in the what? Hospitals. This one, they participate in ward rounds. They participate in what? Ward round and the drug therapy selection. In fact, if you know what you are doing as a pharmacist, your physician cannot do without you. If you know what if you are loaded, your physician cannot do anything without you. They will always consult you for anything they want to do with respect to what? Drugs. They will always call you because they know that you have something to do what? Offer. So they participate in what? Ward rounds and drug therapy selection. They also manufacture sterile medicines and provide drug information in the hospital. Even extemporaneous compounding in the hospital, they do that in the hospital. Some hospitals carry out extemporaneous compounding in the hospital. So by the time you go for your COS, but it's in second year, you may be opportune to work in big hospital where they carry out extemporaneous compounding in the hospital. Are you with us? Hey, I pity people. Continue. Sometimes if I just look at some of you faces, I just shake my head. I pity people. Continue. You still don't understand what you are into. Class is going on, you are just busy, holding phone, laughing, smiling. Continue. I remind you of what you are doing now. I remind you when the day comes. I remind you. Continue. So then they also collectively ensure rational, safe and effective use of medicine. 3. Rational, safe and effective use of what? Medicines. So in all, their ultimate responsibility of hospital pharmacists in all remains ensuring that the right drug get to the right patient at the right time, in the right dose, through the right route, and in the right way. I said that ultimately the role, not just hospital pharmacists now, pharmacists in all, pharmacists, up to ultimately the role of pharmacists is to ensure that what? That the right drug gets to the right patient at the right time. The right drug get to the... No, I'm just giving you overall. What's your issue now? If I like, I say it 1 million times. How is your business? Is that what? I'm done with that one now. For how long will I say that one? If I like, I say I'll say that one once and pass. Okay, I should say it again. Okay, you want rights. They want rational. Okay. Let's go back to rational. I say collectively, pharmacists ensure what? Collectively, pharmacists. I'm done with hospital. I'm not talking about pharmacists in all. Collectively, pharmacists ensure what? Rational, safe, and effective use of medicine. Is that clear?
Yes, sir.
And ultimately, responsibility is to ensure that the right drug get to the right patient at the right time, in the right dose, and in the right route, through the right route, and in the right way. Is that clear? Okay. So, in fact, let me also let you know. Just as you have doctors that specialize, we have doctors that specialize in hematology. What is hematology? Blood, right? Blood aspect of it, right? Those that have specialized in cardiology, nephrology, liver, pediatrics, children, right? And infectious disease. The same way we have pharmacists that specialize in those areas too. Anyway, we have doctors specialize. We also have pharmacists that specialize, because those doctors that specialize in those areas, they are set that there's a set of drug they give to those patients, right? So if there's a set of drug they give to those patients, that means there should be pharmacists also that should be specialized in those what area for effective use of what medicine for the patient in that what category. Does it make sense to you now?
Yes.
Good. So that's the end of the class. This topic. That's the end of this topic. Have you seen how you see how we are going now? Before this year ends, we are done with this course. From next year, I don't know when your exam will come, Sha. Are you aware? Okay, I'll say find out. But if I want to finish this topic, this course this month, sir, if possible. Look at this one. After watching film, you do like this. No, don't go back there. Stay there. But if every time you see me in your class, don't allow me to tell you to come and sit here. Any question? We have 5 minutes to go. Any question? Any question? No question. So, okay. Let me ask you a question. If you don't have to, so let me ask you. See how you just grab a book sharply. Why are you so fast in grabbing a book like that? All right. Okay, let's look at this question. Let's look at this question. The modern focus of pharmacy practice has shifted primarily toward the modern focus of pharmacy practice has shifted primarily toward manufacturing and sale of drugs, B, technical compounding only. C, patient-oriented care and health outcomes. D, traditional herbal medicine. Patient-oriented, yes, I said it now. So patient-oriented and what? Care and what? Health outcome. Number 2, pharmaceutical care means, number 2, pharmaceutical care means A, dispensing drugs for profit. B, pharmacist taking responsibility for drug related outcomes. C, selling OTC medicines only. D, hospital administration. B is what? Pharmacist taking responsibility for drug related what? Outcome. Number 3, the core mission of essential drug policy is A, right patient to right pharmacist. B, right drug, right patient, right dose, right route, right way. C, free drugs for all. D, right pharmacist to right government. Number 4, one key role of a pharmacist as a communicator. One key role of a pharmacist as a communicator is A, dispensing without asking questions. B, keeping silent about the side effects. C, providing objective drug information to patients. D, avoid contact with physicians. These are simple questions. The pharmacist ensures confidentiality under the function. The pharmacist ensures confidentiality under which of the following functions? A, trainer. B, communicator. C, supplier. D, health promoter. Communicator. All right, thank you very much. We'll stop here for today. My attendance, please. Grasp. Thank you very much. God bless you. See you when we see next.